Prasad, thank you so much for your time. It is just such a horrific situation coming from your country. I understand that in the last 24 hours, the country hit a new daily death toll high, over 4,200. Tell us more.
Good evening. Yes, we are in a very, very difficult situation in terms of the numbers that we are reporting and seeing. Well, if there was some silver lining, if I have to say, look among the dark clouds, from Saturday to Sunday, when we were recording almost 400,000 cases per day, the official figure today is 348,000. There is no consolation, but in terms of the last 2 days over the weekend and as we enter the middle of the week, there seems to be some slight dip, partly because the number of steps that have been put in place, and also most states have already imposed a lockdown, which means a lockdown partial or full, and restricting movement of people unless it's absolutely essential. That's where we stand here.
All right. So can you tell us, is it possible to say whether India is through the peak of infections, or could it continue to climb?
Well, that's a very difficult question for me to say, but whatever reports, and I've heard the scientific community tell us, there are various reports that some states which have reported higher cases, especially in the north and Punjab in particular, the peak would have, it will be plateauing very soon, if not has already not done, is what we hear. But in a large country like ours, from north, south, east to west and northeast, it's a big geographical spread. So there is not going to be a uniform countrywide peak at any point of time. Immediate concern is that. But some states might, like Maharashtra, for instance, they say they expect the peak to be over in a few days to few weeks. But again, I would not like to hazard a guess, but go by what the scientific community tells us all the time.
And meanwhile, the stories of desperation are just heartbreaking. Two that I've heard about is that there are calls to legalize mercy killings because people are suffering so much, not being able to get access to hospitals or oxygen. The other report is that is suspected COVID bodies floating in the Ganges River. Are these things happening? Is this really how horrific it's getting?
Well, let me put it this way. We have seen reports about the bodies floating on the Ganges, and this happened in particular in the eastern part of Uttar Pradesh and a neighboring state of Bihar, where we are reported between 150, and the number could go up as we hear. But the fact is, one of these factors which I did mention on the ENCA a little before, maybe a couple of weeks ago, the biggest concern for authorities, the health authorities and the administration and everybody, is a possible spread into the rural areas, because that's where the issue is. One, the number of people, and as I mentioned even back then, the kind of pressure on medical facilities which are much less in the rural segments. That's one area which governments are really very concerned as put in measures, but these will take time as we go from where we are. But say in the cities, there has been a slight control in terms of availability of beds, because a number of facilities have been built again, temporary shelters, temporary facilities have been created by the paramilitary forces, the military and the defense forces, and several public volunteers and non-government organizations have come in and stepped in to augment the facilities. So that's where we stand here.
All right. Thank you so much for joining us, and we do hope that things start to improve soon. What an awful situation. Many thanks. Any update on vaccinations? Has anything improved?
Yeah, the things are, we're talking about 175 million people have been vaccinated, as the dashboard told us a little while ago. Of them, almost 38 are the second dose. But yes, the vaccinations have been now open for all people between 18 years and 44. So we are seeing a huge surge in registrations and numbers, and states increasingly asking for the center to make sure that the vaccination doses are available. So I think that's where the debate is going on in this country, how to increase the supplies for vaccination doses so that more and more people are inoculated against the virus.
Absolutely. Well, thank you so much for your time. Much appreciated. Former Senior Associate Editor at The Tribune, coming to us live from India. That was Prasad Kunduri.